Good morning and welcome to Seeking Wellness, Our Bodies Explained on WPKN 89.5 FM. I'm your host, Dr. Jennifer Pierre, your neighborhood naturopathic doctor and public health advocate, bringing you the best of what integrative medicine has to offer. We broadcast from Bridgeport, Connecticut on the fourth Saturday of every month from 9 a.m. to 10 a.m. Here in Seeking Wellness, we discuss various health topics while clarifying some misconceptions about naturopathic medicine and providing education from a clinical and holistic perspective. If you're a longtime listener, welcome back. If you're new to the party, come on in, take off your shoes, and get comfortable. The call-in number is 203-336-9756, so feel free to call in and talk to us about anything that you'd like to ask on our present show. So today we are having a special guest. Her name is Dr. Christina Wright, and Christina will be talking to us today about pharmaceuticals. So I'm very excited. And I am going to give you a little bit of information about her, and then she will be coming on. Dr. Christina Wright is a proud graduate of FAMU College of Pharmacy. She completed a fellowship in medical information focusing on drug development and immunology at Bristol Myers Squibb. Presently, Dr. Wright is a senior medical liaison for cell gene neurology, where she educates healthcare providers on the pathophysiology, comorbidities, treatment, and prevention strategies of multiple sclerosis. Prior to the above, she has held several medical roles in different pharmaceutical companies where she developed and executed strategies and supported research to bring new therapy options to patients. Her passion is to educate on all aspects of conventional therapy to empower patients as they maneuver through the complexity of diseases and the healthcare system. She also strives to collaborate with other healthcare professionals to bring awareness and solutions to the disparities in healthcare among minorities in the U.S. Dr. Wright has also had a career as a professional ballet dancer. She merges the two careers often by helping others find a hobby or skill that they enjoy that brings an element of discipline and physical exercise. So that is some great information about Christina, and you will get to know her in this hour. So welcome, Dr. Christina Wright, to the show. Hello, Christina.
Hello. Thank you so much, Dr. Jennifer. How are you doing?
I'm good. Welcome. Thank you so much for joining us. I'm really excited for you to share this information today. There's so much misinformation about pharmaceuticals, and I think the listeners will really be able to get some good education today and some empowerment as far as knowledge on pharmaceuticals. So
Yeah,
we're going to
absolutely.
jump right into it. So, Christina, just tell the audience a little bit more about who you are. They already have your bio, but exactly who you are and what you do and what a pharmacist does in particular.
Yeah, absolutely. No, before I do that, I want to thank you so much for this opportunity. I don't really know if there's other opportunities where a person who has a career working with conventional treatment specifically, and then someone who has expertise in naturopathic medicine coming together
Yes.
and having a conversation. So this is really unique and really great. So thank you for this opportunity and this idea.
Of course.
So, yes, I am a pharmacist. I started off, traditionally went to pharmacy school, got training as a pharmacist. But my passion was really in research and development and bringing new therapies to the market. So there's a lot of diseases that are chronic, and then there's a lot of diseases that when you get the diagnosis, it's very scary because there's not a lot of therapy options. So I wanted to be in the forefront of that. So as a pharmacist, it's a career that if you get into it, there's so many different avenues that you can work in. So the most traditional pharmacist that most people know about is that pharmacist that works in retail. So the pharmacist that works in Walgreens or Publix or a grocery store, that's the most traditional type of pharmacist. And that's the first person that I saw. My aunt is a pharmacist, and I saw that she was someone who was respected in the community, someone people came to about advice about their medication, and I wanted to be that person. But then when I learned more about what pharmacists do, I learned that there were other things that pharmacists could do. So one of those other things is, like I mentioned, worked in pharmaceutical industry. So that's what I do. Right after pharmacy school, I did a postdoc research for a year with Bristol Myers Squibb in medical information. And really, when you're in pharmaceutical industry and the medical side, you work as in departments that are an extension of research and development. So your role is really involved in different phases of drug development. And hopefully we can talk a little bit about that, because I think not a lot of people know about the strenuous process that drugs have to go through, prescription drugs have to go through before they go to the market. But that's what I do. I work in drug development in the different stages of drug development. I'm a medical science liaison, so my role works, I work with healthcare professionals, doctors, and I educate them on the new drugs. I also work with doctors who are using drugs in ways that they might feel it works better than, what it's currently approved for. And so in order to have more data to support the use of that drug, I come in there and I say, how about you work with my company, or, we can work with you and actually do more research so that you can have more data to support the use of that drug. So that's a little bit of what I do.
Do you ever get into situations where, as a result of having those interactions with physicians, where your company decides to do a little bit more research on a particular potential use of that drug?
Yeah. Excuse me. I have never had that experience, but that is essentially why my role is created. The role that I do, the medical science liaison role, is really made to be a partner. So I'm like that liaison between the pharmaceutical company or researcher and the doctor, right? So, and that's why we're usually people who are healthcare professionals ourselves. So I have relationships with doctors, and they share with me what they're doing. So they'll say, I'm using this drug that your company currently produced and has in the market. But I realize that it works really well in this patient population. This patient population really loves it. There's very few side effects. It's actually working really well here. Maybe you should explore that. So I've never had that experience, but that does happen a lot. It happens quite frequently. A lot of the drugs that we know of today that are actually very, very well-known drugs didn't start off being approved for that use. It started being approved for other things. A lot of medications that were originally designed to treat cancer are now used for other things, and vice versa. So, yes.
Wow, that's great information. So that's really helpful because, like you mentioned in the beginning, most of us are used to thinking about pharmacists in that retail space, and many people are not aware that you can, basically move into that area of research as a pharmacist. So that was really helpful. What would you say the biggest misconception is about pharmacy and pharmacists in general?
Yeah, I mean, we can go for a little while talking about this, but I think there's a lot of misconceptions. I think the point of a pharmacist is not to be that person that works in retail just to give you your drugs, right? The point of a pharmacist, the reason why you have pharmacy, is to have that person who specializes in the drug that works hand in hand with other healthcare professionals, like in a team, basically, providing that specific expertise on the drug. But the point is really to foster proper use of the drug, proper education of the drug, to understand the efficacy and safety, and then to understand, the real expertise is to have an understanding of how to use that drug with other drugs, and how to use that drug with natural agents, and how to use that drug with over-the-counter drugs. I think the misconception is, and it makes sense, right? Pharmacists, usually when you go to Walgreens, and I've had that experience myself, being a pharmacist, and I wanted some drugs, and there was a long line, and I needed to go to the next appointment, or I needed to go to work. it's a rush, right? So I get my
Yeah.
medication. I'm upset because I had to stand in line for a very long time. I mean, that's just my experience. And I know that other people have different types of experience. So that pharmacist or a pharmacy tech is just a part of that transaction. So that's one misconception, almost like just, yeah. But the other misconception is that the pharmacist is an extension of the business of wherever they're working, right? So
Wow, yeah.
they're a Walgreens employee, a Walmart employee, so they're business minded. They want to sell the drugs. Whereas, yes, they are employed by Walgreens for sure, and that's where they get their paychecks. But the reason why, I'm 100% sure, the reason why a pharmacist is there is because they have that expertise in the drugs, and they want to promote the safe use of that drug. So I think that's one of the big misconceptions of pharmacy. And then, of course, the whole other conversation is, the perception of big pharma and researchers and the people that bring, So that's the other thing.
Yeah, I definitely want to talk about that later.
Yeah. But for the purpose of your question, when it comes to pharmacists itself, and I definitely want to drive that, don't not utilize your pharmacist. One of the reasons why I went to pharmacy, like I said, was my aunt, she worked at a Department of Health in Tallahassee, Florida, and people knew her by name, and they trusted her. And she was like the neighborhood doctor, and they came to her and they asked questions. So I don't want that. I definitely want to just drive that point across.
So what questions, if I'm going into Walgreens or CVS or something, what questions do you think a person should be asking their pharmacist?
Oh my gosh, so much.
And obviously there's a lot. So just, one or two that you think might be helpful to ask.
Yeah. So it was quite some time ago, I think quite a few months ago, you and I were both on a panel talking about how we can empower each other, right, in the healthcare, within the healthcare system. And one of those things was, the panel was called Ask Your Doctor, right? And we all came into agreement. A lot of us, we're healthcare professionals, and we had different backgrounds. But what we all agreed in was that we need to know the right type of questions to ask, right? And as healthcare professionals, we know that our family members come to us about questions.
Yes.
We're like, why didn't you ask your doctor this? Or why, and then, we understand doctors only, have maybe 10 minutes to talk to you. When you go see your primary care physician, they may only have 10 minutes to talk to you. Even if you're speaking with an advanced practitioner, like a nurse or a nurse practitioner, they only have 10 minutes. So, you have questions. You ask your pharmacist those questions. You are the person that knows your body more than anybody else. You should utilize the pharmacist to ask questions. So I would say if, you're going to Walgreens or CVS, you may not have a lot of time, but every pharmacist, and I know this because I'm a pharmacist, has to ask you if you have questions.
Yes.
Right? They have to. By law, that is required. They must ask you if you have questions. You utilize that time. I don't care who's behind you. If you have questions about your medication, you ask that. Ask that. Ask about what are the important side effects that I need to know about this. Say, if you have access to the other medications that I am on, are there any drug interactions I need to be questioning? Or do I need to sit down with you and talk about the medications that I'm on? Are there some medications that I shouldn't be on? And we've talked about this before, that there's a lot of polypharmacy.
Yes.
There's a lot of people that are on medications that do the same thing, So, start asking those questions.
Can you tell people a little bit what polypharmacy is for those who are not familiar with that term?
Yeah, sorry about that.
It's okay.
Polypharmacy, means that you are being prescribed, or so you might, so I guess it's better to say this, in your medicine cabinet at home, right? So whether you're taking it or not, there are medications in there that do the same thing. So it's called polypharmacy because, you have 2 or 3 drugs that are ultimately doing the same thing. So it's additive effects that are happening in your body. And that sounds really bad, but it can easily happen by the mistake of just a lot of people, like the innocent mistake of a lot of people. It could happen when you pick up drugs from different types of pharmacies, right? So what they're doing is they're not monitoring what you're getting from another pharmacy. So if you go to Walgreens here and then you go to Walmart in another city, or you go to Walmart in that same city, they're not monitoring, Or if you go to a primary care physician and they prescribe you something, then you go to a specialist who they may have referred you to, and for whatever reason, there was not a monitoring of, hey, what has that primary care physician been giving you? And then they still prescribe you something. And then it gets to the pharmacy and they're rushed, or they don't look at something and it gets prescribed to you. So it's often not the fault of one person, but in my opinion, that's when you say, is there any opportunity that, we can walk over to that little consulting area that you see in Walgreens and CVS, and can we talk about my list of medications? And you can do that even with your doctors. They may not have time, but at least they know that you're being proactive, right? And so that's what polypharmacy is. There's a lot of other things too, like you might be taking you might still be taking a dose that you shouldn't be taking anymore. And I'm not trying to scare you, but I think that there's a lot of things that can happen when you're picking up medication from different places or when you're going to different doctors. Or another example that I think is the most common, let's say that you go to the ER for something, and it may be something extremely minor, right? You break something, you sprain something, whatever it might be, and they treat you, right? And they give you something, or let's say it's even an antibiotic, whatever it might be. You get that list at the ER, and you get that medication. That list might not be translated to your pharmacy or translated to your primary care physician. So there's a lot of ways where you just might have a lot of different medication lists, and that's why I go back to your cabinet at home. That's the true indication of what you're taking. Not even a list, right? Or not even records that might be in a doctor's office or pharmacy. It's your medicine cabinet. So the good old-fashioned way that I learned in pharmacy school, they would say, they would have fairs, like health fairs, and they would say, bring in your medication list, but also bring in your actual medicine, like the actual bottles from your medicine cabinet. Bring it all in a bag and lay it out in front of a pharmacist. That way the pharmacist can really see what you're taking. And you know what else that includes? That includes supplements, that includes vitamins, that includes over-the-counter, and all the antibiotics that you still have from 2004, 2005, 2010. All of that would be laid out, and the pharmacist will be able to say, okay, they will be able to guarantee your list of 20 pills to 5 or 6 or hopefully 2 or 0. So going back to your question, what do you need to ask? I think the first thing is take advantage of when the pharmacist asks you if you have any questions. And if they don't ask you that, then, that's a problem. They need to be asking you that. Oftentimes when you go to the pharmacy technician is the person who is doing everything. But usually the pharmacist should still come up to you and say, do you have any questions? If it is a new prescription. If it is a refill, sometimes they won't ask you that, right? So that's another thing. But again, that doesn't mean you don't ask, because you may have other medications that you started between you starting that drug originally and a refill. You may have picked up an over-the-counter medication. You have maybe picked up a natural medication that you felt like would help with your sleeping. All these things you need to inform your pharmacist about, because there can be some drug interactions or additive effects or canceling effects that could be happening. So you want to make sure your pharmacist asks you that question. You want to pull your pharmacist in, and you want to say that you want to have, kind of some checkups, the medications that you're currently taking. Make sure there's no drug interactions. Last thing, over-the-counter medications, ask about that too. I know you may not have all the time in the world, but pull in a pharmacist and ask about your over-the-counter medications, because that's still going in your body. Especially if you're taking prescription drugs. I think that's probably when you want to take advantage of a pharmacist. Hey, I have 4 drugs I'm taking for, I might have a blood thinner, I might be taking a water pill, and I also might be taking something to help with my anxiety right now. I have those 3 things, and I want to pull something off of the counter. If I were you, I would talk to the pharmacist about it.
Wow.
But if if you're not taking anything, then okay, maybe not so much, but that's what I would suggest.
That is great. So the phone number to call is 203-336-9756. I think if you're out there and you're listening and you have any questions about this, it would be a great time to call in. This is amazing information. I'm so happy we decided to do this because people do not utilize their pharmacists. And I find that in practice, many of my patients don't even know why they're taking certain medications. I see a lot of polypharmacy, and I think because I'm a naturopathic doctor, people think, oh, we're just dealing with supplements, but we're trained on pharmaceuticals as well, because the reality is most of your patients are going to be on pharmaceuticals. So you need to be able to have the discussion with them when there hasn't been time with other physicians to say, okay, this is why you're taking this and why are you taking this? So when you talk about how in the stages of basically seeing different healthcare providers, every healthcare provider is responsible for going through that list with you. So, like you said, it's definitely imperative that all of us kind of step in and give this kind of information. But if anything, at least at that final stage, when you have a pharmacist, you can also get another check. So this is helpful for checks and balances, error prevention, the importance of taking meds as directed. That's a big one I see as well. I have a lot of patients because they don't want to take, prescription medications because of the side effects. And they're like, oh, they come to me and I just want to take something natural. I don't want to take any drugs. And, you have to understand that you have to be at a certain stage where then you can decide or have a conversation with your physician about not being on a drug. But people will just take themselves off of something because they're so afraid of side effects. And trust me, I understand that because like I said, I catch a lot of polypharmacy. I have, definitely some issues with, when that's not being monitored. But the reality is, we're all in this together. So we just have to figure out ways, and education, is a big way for people to become empowered. And it's not challenging your physician, but it's having that knowledge where you can ask, why am I on these 3 medications for the same thing? There's situations with like blood pressure, for instance, where maybe sometimes that person does need 2 medications, even 3, to manage their blood pressure. Obviously, there's other things that you have to discuss at that point, right? But that does happen. So it doesn't mean every time you're taking more than 1 medication for a reason that's wrong or there's an error in that. But when you have this education, you can say to your doctor, okay, you put me on this before, now I'm on this, what are we trying to accomplish with, the multiple medications? So this is really, really important. And also antibiotics, I want to say this especially. We have this term in the medical community, antibiotic resistance. And that is when you're taking an antibiotic and you don't take it for the full length of time and you take yourself off of it. What happens is the body now is not able, to fully, I would say, kill that organism because you stopped taking it before the time. And so the next time you may take that drug, it may not be effective anymore because the body, it recognizes the drug. It's like, oh yeah, I used this before. This is not an issue. And so it doesn't even work. So that's a really big issue in the medical community, again, because of fear. So the whole point of me wanting to do this show is to dispel some of the myths, to clear out some of the fear and concern around medications. And trust me, I deal with a lot of the side effects, but I want people to really feel comfortable just asking questions and getting the information they need.
So Dr. Pierre, I think just one point, and I know we have a couple other things we want to talk about, but I just wanted you to share really quickly in relationship to that, because I feel like a lot of people don't think that a doctor in naturopathic medicine and a doctor in pharmacy can actually be allies, right?
No, they don't.
But I think the point that, at least that I'm really trying to drive, is that you have a healthcare there's a healthcare team, right? And not all of us, agree 100% of the time because we have different training.
Yes.
Right? So of course, all of us feel that, I'm specifically needed and I'm specifically needed. But when you look at a patient, a patient's going to strive to be their best healthy self when they have a full healthcare team. And so just, especially you, because I feel like your expertise and what you do is you do actually treat the entire patient, because to your point, someone that comes to you is going to want your expertise, but they may still have a lot of residual, per se, from their conventional treatment or therapies, right?
Yes.
Whereas it may be different. The person coming to me may have only had experience with conventional, right? How do you educate a patient to help them understand that it depends on where you are and what you need to be treated, right? Like, I don't think there's a right or wrong answer. I mean, maybe in some situations it might be right. Like, there are those situations where people are just on medications they don't need to be, right? That's
yeah.
But how do you educate your patients to help them understand that, there's a healthcare team, and you need to know what's best for you at the time, and how do you, when you see a patient that's still on some conventional therapy that you can't completely stop them on, but you want to start them on something else, how do you help them feel comfortable in understanding understanding that?
So I'm pretty firm. It depends on where they are with the situation. Sometimes if I notice something that doesn't look right, like there was a patient who was on Keflex for, a skin infection, and they were on this drug for about 2 years, like stuff like that. I'm like, that's a problem. You need to go back to your doctor and get off of this. So despite a lot of medical doctors taking my patients off of supplements, I don't take anybody off of anything. I mean, the patient ultimately has their right to do whatever they want to do, but the doctor it has the education to instruct them on what is best for them based on their knowledge base. You don't go to medical school for no reason. So sometimes I'm very firm, like especially with blood pressure medications. I will talk to people about the dangers of just taking themselves off, and then the risks of strokes and, other, cardiac incidences. So I definitely am firm when I need to be firm, but I'm also loving, because what I know about patients is that they really want to be in a situation where they feel comfortable talking to their doctor. And a lot of people come to naturopathic doctors because they don't feel comfortable talking to their medical doctors. They feel like they're not paid attention to. And a lot of times if, and I understand the issue of time, my office visits are a lot longer than the conventional model. So I get it. But in the interest of time, they may feel rushed, and so they can't ask the question. And so they'll come to me and say things like, they don't listen to me, or I don't feel like I can talk to them about this. They're basically, denigrating my supplement. They say all supplements are trash, so I find that I'm in this situation where I have to do a lot of the education because of the way the system is set up. So I'm firm when I need to be firm, and I'm loving at the same time, because I listen and I understand that this is, they're concerned. And if they don't have the education, that's where a lot of the fear is. So once I go through the education of why they're taking the drug, what it's preventing, how to deal with the side effects, because we talk about that a lot. And also sometimes I recommend another drug that maybe their physician, they might not have thought of it, but there might be another drug that you can use instead that may have, that may work well with this patient. So when they have that information, now they'll go back to their medical doctor and they'll explain, hey, what about this? Can I try that? Yeah. Or this side effect is really, really breaking me down. Is there anything else I can use instead? And sometimes, and with that empowerment that they have, a lot of times things will move more smoothly. You know, that sometimes there is resistance with their other physician, you know, because I don't know, they think I'm trying to take over. I don't know what it is sometimes, but for me, it's kind of like you said, I'm really big on having a healthcare team with everyone working together. And, you know, I've said this all the time. In an ideal world, it would be an integrative healthcare model where everyone is talking together, where medical doctors are referring to naturopathic doctors because it's not their wheelhouse to talk about supplementation and those interactions. And that's fine. Yeah. You know, everybody has a strength and it should be used. So thank you for bringing that up, because it's true. It's a big deal, and I deal with it a lot. And I think medical doctors should be aware that this is happening, and it's okay that you don't know about supplements. Like, it's not your training, and that's fine. You just have to refer them to someone who will give them that training. So thank you for bringing that up.
Thank you.
Again, I'm going to just give the phone number in case anyone wants to call and ask have any questions. 203-336-9756. So we are going to switch gears, and I'm so excited for this part. I want you to talk about the stages of drug development, especially since you are on this research side. This research is so important. I tell people my background is also in public health, so I love research, and I've done research in lots of different areas. So I'm so excited, and we learned about drug development in my public health program. But I want you to talk about this so people know, how do these drugs get to market?
Yeah. Okay. Awesome. Yeah, I'd love to share that. Like I mentioned, this has been kind of, I guess, my life for the past 6 years being in pharmaceutical industry. But I work on the medical affairs side. So medical affairs spans most of the phases of drug development except for the very beginning. So drug development starts with research, basically discovery. And that happens in the lab, right? So that's typically a researcher, chemist, or people who are working specifically in the lab. And often discovery happens for a lot of different reasons. It could be that science is advancing when looking at a disease. So having better understanding of disease, more insight would cause more work to be done in the lab and more discovery. Sometimes technology, that's a big thing, causes more work to be done in the lab. And then other things could be just like we kind of talked about it already. If there's a drug that we realize is really effective in another area, that goes straight back to the lab again for more discovery. So that's discovery, right? That's the first part. Majority of the things that happen in discovery do not move on to the next thing. Right? It just kind of hangs out there. But every once in a while, something moves on to the actual preclinical phase. The preclinical phase is the very beginning of the development, and that is what's done in animals. So, right, rats, mice. The more later stages of preclinical is actually done in monkeys. So that's a whole other conversation. But
wow, okay.
Preclinical phase, right? And the point of the preclinical phase is to really understand the toxicity of an agent, and probably more so dosage, right? So what amount of drug is going to be toxic and what amount of drug is not going to be toxic and actually have some benefit. So that's what happens in the preclinical phase. And the terminology, the scientific terminology that's usually used is in vitro or in vivo. And in vitro is usually actually in tubes, and in vivo is actually in the animal itself, right? So obviously we aren't a rat or a mice, but it still allows you to kind of see what potential toxic levels can be of a substance, right? And then, a lot of drugs actually come from natural herbs, but a lot of things don't, especially some of the drugs nowadays. But that's the discovery element. Now, a research group or an actual pharmaceutical company may find out about this discovery agent and then invest in it and then submit an application to FDA called an IND, it's an investigational new drug. And that starts the long, strenuous process. And what that application will do is FDA would look at the animal results, see if it's something promising, see if it's something that should be pursued further. And they provide all the protocols, all of the regulations and guidances that are needed for that pharmaceutical company or that research group to follow for the next phase, the next 3 phases, so that they then can be ready to submit what's called a new drug application, which is something that FDA will then approve, it will actually review, and then if it's approved, that drug goes out on the market. So let's go back. So, everything looks good in the animals. They submit an investigational new drug application to FDA. They get all the rules and information that they need. Then the actual drug goes into what is called, or that substance, because it's not really a drug yet, or that product goes into what's the clinical phase. So the first part was preclinical, now it's the clinical. The clinical phase is separated into 4 phases. Phase 1, which is usually a program that involves studies that are very short with a very little amounts of people, and that those studies are done to just see, really to just test further the dosage and the safety of that drug. But it's usually in a very small patient population. Phase 2 is a little bit larger, so it's usually about 100 patients. The most important thing about phase 2, ideally, is to make sure that you have patients that have the condition or disease state that you want to pursue that drug in. So it's about 100 patients. Again, you're looking at safety. I want to say something before I move forward. Usually this is done in a very controlled environment. So there is quite a few, like I mentioned, regulations and guidances that have to be followed that goes all the way down to what the actual clinical study site has to follow in order to be involved in these studies. I understand this very well because this is a part of my job, right? My job is to work with some of these clinical study sites that are doing these trials with our drugs, but there's a long process that they have to go through to ensure that there's safety for the patient population. So let's go back. So that's phase 2. If everything looks good at phase 2, FDA is okay with it. There's also what's called an institutional review board, which is abbreviated IRB. They are also involved with the approval process throughout these phases. So not only FDA, they have another board that ensures that there's safety for the patient population, things are clean, the clinical sites are following what they should be, the pharmaceutical company is doing what they should be. So there's 2 regulating bodies, technically, that are approving what's happening. When they are okay with what's going on, it moves into phase 3, which usually involves thousands of patients, right? That involves sites all over either the U.S. or, if it's a global thing, all over the country. And in those trials are really looking at the use of that drug. And the drugs are usually administered how the pharmaceutical company or the researchers believe that it should be administered. So if it's an oral agent and it's supposed to be used twice a day, then that's how it would be administered in a study. Efficacy is monitored as well as safety, the most common adverse events, everything. That's what's monitored in that phase 3 trial and the phase 3 trials or program. The phase 3 program or trials is really the footprint of what FDA is looking at for the approval of this drug. They're basically looking at that and saying, this is what we believe this drug is going to do. Now, there's a lot of, obviously there's a lot of limitations to that, right? Because, FDA is going to approve a drug by looking at a phase 3 program that includes 3,000 patients that is extremely regulated. These are patients that, went through, it checks, inclusion criteria and exclusion criteria. So they have to look a certain way because obviously we want to make sure that it's safe, right? But now it's going into a huge patient population, right? So that I'm going to put in the plug again for pharmacists and the healthcare team. When a drug goes from phase 3 and approval to a large patient population, which includes patients that were probably not involved in the clinical trials, you need to rely on your healthcare team to have a better understanding of what does this mean for me? What should I be doing? What should I be paying attention to? And the healthcare provider should be able to answer that question, or if not, they should reach out to people like myself who work in pharmaceutical companies, who work directly with drugs, to be able to answer those questions, because there is a limitation from coming from a phase 3 program that's only in 3,000 patients to larger patient population.
I'm happy you brought that up, because that's important to point out.
And that's another reason why some drugs that are approved for one indication eventually end up getting approved for another. That's another reason why, and this, I'm a big advocate for this, and I know that you are too, minority patient populations in the U.S. We're not exactly 100% represented in a lot of clinical trials in the U.S. So when it moves from being approved into the patient population and then we take it, not that it's always, it's very rarely a difference, but there's just no data really to support the use in minority patient populations. So I work often with physicians who have a lot of minority patients. So they want to do studies specifically in minority patients so they can have an actual database of data to see, okay, everything looks the same. Or maybe we should provide this counseling, or maybe it should be taken this way, whatever it might be. So I just want to throw that plug in there. But so after the phase 3 program is done, then the pharmaceutical company or the research group, excuse me, at this point usually it's a pharmaceutical company, because phase 3 programs are very expensive, right? So a research group does not have the resources to do a phase 3 program. So usually a pharmaceutical company, they usually invest in that product. So then they submit what's called a new drug application to FDA, and that includes all of the clinical trials, every bit of information possible on every single participant involved in the clinical trials. That information is available, FYI. So then FDA looks at that. They do this process. It's usually about 30 people involved in the process. It's FDA people. There's actually civilians, individuals in the community. They're healthcare professionals. There's usually a board of about 30, and they approve the drug. And then the last phase is the phase 4. And phase 4 is post-marketing, usually surveillance. So it's looking at the drug in a larger patient population, but it's usually to look at safety and continue to have that safety surveillance on the drug. So that is essentially the drug development process in really quick review.
Wow, thank you. That was very detailed. I appreciate that. I think that leads us into the next topic, our last topic that we're going to be discussing, and that is the distrust of the pharmaceutical industry and, quote unquote, big pharma. And when you mention that phase, particularly, the last phase 4, and how a lot of the final results are, really how it's going to work on patients and what that looks like. When people hear things like that, they get a little nervous. This is a little controversial, but, I'm going to bring it up. Some of the advertising of big pharma, people feel it's very predatory. So can you talk a little bit more about the distrust of big pharma and how, I think you did a great job in explaining why it's necessary, but also kind of helping ease some of the fears in that, because people feel like they're being targeted, honestly, for, billions of dollars in this industry. So.
Yeah. I definitely understand that. I think that the distrust is definitely warranted in a lot of cases, and big pharma is a business for sure, right? So like any other business, and that's even other healthcare businesses, right? Hospitals, whatever it might be, they're still a business. So that is definitely warranted. And historically, there have been events and situations that definitely warrant distrust, right? But I think from my perspective, and having worked in pharma, I believe that you can't dismiss the fact that sometimes you may be taking conventional treatment, right? Like we're in this world where you're going to pick up medication off of the shelves, or you're going to go to the doctor about advice about something, and you have the option of taking a medication or not taking medication. I do believe that big pharma or pharmaceutical companies do provide ways where you can get information, and I think that is in them hiring healthcare professionals, right? So, and I'll just go back to my original plug. The reason why I went into pharmaceutical industry is so that I can push with the ethical part of it, right? Is to be transparent when it comes to the entire monograph of a drug, right? To be transparent about it, to directly point a patient to what they need to be concerned about, what they don't need to be concerned about. To help them ignore potentially some things that may not be that might be for advertisement purposes. If I said that right. Ignore that if that's not specifically relevant to them, and focus on what needs to be focused on. Help them navigate through, what big pharma can provide. I think the other distrust part of it is that it is big pharma. It's huge. If you don't know where to get the information, then it is scary and probably not beneficial at all, right? But I think the healthcare providers do have access to big pharma. That's what my role is.
That is true.
I have dinners with specialists, right? I sit down and I talk to them, and I provide them with information directly from pharmaceutical companies myself, right? And granted, I work in a conglomerate where I get information, right? And I get the information I know with what's given to me. But there is ways where you can get what you need regarding the drugs that you're on. So I'm not dismissing where the distrust can come from, because it is a business. But I do believe that a lot of that can be your distrust or what you don't know, you can get from pharmacists, and you can get from big pharma through, pharmacists or through healthcare professionals. That's my answer to that question. I would love for people to ask questions on that and share that, because I think where people's distrust comes from in big pharma is very personal and it's different. So I can, answer it differently per, the specific situation.
That's true.
But I mean, from a general perspective, I think that it can be narrowed. You can reach out to a pharmacist, or a healthcare professional does have access to a medical science liaison or a nurse educator to get the information that is needed. And that information is there. Like I said, FDA, the application that is sent to FDA for approval includes absolutely everything for a participant. And www.fda.gov has a lot of information. So let's say a new drug gets approved. The next day or that day, the application or the summary of that drug that was reviewed extensively by that board is available. So, wow. and at www.fda.gov is public. So that's not just for big pharma. That information is made available. So, I think that there's ways to get information that some information that you need.
Good. I want you to just say your role again, so people know that role in the terminology.
Yeah, sorry. So I am a medical science liaison. Okay. So most big pharmaceutical companies have this role. And this role, we work directly with healthcare professionals, not patients. Actually, that's not a part of my role. My role is to work directly with healthcare professionals, specifically healthcare professionals that are specialized in a specific area. So I work in multiple sclerosis. I work with neurologists who specialize in multiple sclerosis, and my role is to have a personal relationship or a professional relationship with those neurologists in Georgia and in Florida and in Puerto Rico. But I have colleagues that work in other parts of the country. So if you are someone, let's say, with multiple sclerosis and you are meeting with a neurologist that specializes in multiple sclerosis, they should also be talking directly or have kind of like a direct route into major pharmaceutical companies that are putting drugs out on the market. So we talk about this. This is another way of empowerment, right? Like, you know that you're talking to this doctor and you say, do you have the ability to ask questions about this drug? Do you meet with even sales reps, right? Sales reps work. The difference between a sales rep and a medical science liaison is sales reps, they work on the marketing sales end. So they work on their conversations are supporting the label, what FDA has approved the drug for. So they're also extremely helpful. But if you want to have knowledge on how that drug works in totality, which is usually medical doctors don't always just use it for one thing, then you can ask for medical science liaison, right? So there is, my role as a medical science liaison, I work directly with physicians and researchers that are specialized in the area, and I provide them information to educate them on the drug.
Perfect. So I'd like to say something before we close out, and then I'm going to ask you a take-home message. But I wanted to say on the naturopathic end, the reason why it's important to be having these conversations, I wanted to make sure people are aware of certain interactions with natural supplementation and drugs. For instance, taking garlic, ginger, ginkgo, ginseng with blood thinners can be problematic, and fish oil. So I am all pro supplementation. As far as naturopathic doctors go, I think people think it's, anti-drug, and it's not the case. I'm against overuse of certain drugs, and also just having the education, the proper education, having that team. People taking antibiotics with probiotics, that kind of situation, not knowing how to properly use this. So I implore you again, please, if there are medical doctors listening, I need you to use other members of your team, reach out to naturopathic doctors. We can work together on getting this information out, and also for people to understand that you can speak to your pharmacist about this. You can find that, your medical doctors have this information with the medical science liaisons. And, I just want you to wrap up, Christina, on anything else, because we have to go, but anything else you want to leave with the listeners, a take-home message for the show?
Yeah. Well, I want to thank you first. This is, like I said, I don't think there's many places where we're going to have this type of conversation. I would want to push for the actual healthcare society to do more of this. I wish that there were more spaces where naturopathic medicine doctors are working with pharmacists, and that there's more opportunities for conversations like this. Like, I would really want that to happen. There's so much that I can learn from you, so that's first off. The other thing I wanted to take home message is I want people to know that we can be allies, right? So when you go meet with a pharmacist or you go talk to a pharmacist, don't only talk to them about prescription drugs. Even though a pharmacist is trained mainly in prescription drugs and OTC, they need to know about the other things you're taking. So don't act like it's a siloed situation. What might happen is the pharmacist would say, I don't know about it. And honestly, sometimes pharmacists may push it away, right? But I think it's so important to be look at it in totality. It's all going in your body. So everything that's going in your body needs to be shared with a pharmacist.
Thank you so much. Thank you so much. We have to go. I love this. Thank you so much, everyone, for tuning in today. Thank you, Dr. Christina Wright, for coming on. Please be sure to check out our website, wpkn.org, for our past shows, and we'll we'll see you again on the fourth Saturday of next month for another informative topic. Take care. Thank you so much, Christina. Talk to you soon. Enjoy your weekend, everyone.